Hi River Oaks families, it's Dr. Gold. We're doing this little video clip hoping to enhance what I can communicate to you by newsletter. I just wanted to give you a COVID-19 update as we're approaching June because of course for all you dog owners, you know June begins the heartworm season. So the normal protocol that we've always followed, which is appropriate and on-label use of the preventative medications, we need to do a blood test of every dog every spring to ensure that they are free of the disease before we start the preventative medication. Now, under the pandemic guidelines with social distancing, our goal is to maintain that distance and allow people to stay away as much as possible. So the Ontario Veterinary Medical Association and the College of Veterinarians of Ontario are supporting right now, while we're under urgent care only protocols, to dispense medication so the dogs can get the preventative that they require and hold off on the blood test until the urgent care requirement is reduced back down to essential care, essential services. So what does that mean? That means by June 1st, all of you dog owners need to come by to pick up the heartworm preventative medication so that we can start the dogs at the beginning of the month in June, and that goes 6 months right through November. Now, we have a number of different heartworm medications that we have dispensed in the past based on lifestyle of the dog and exposure risk. So we have medications that are either very minimalist, like the Heart Guard, which is a once a month chewy, beef flavored, which controls heartworm and a couple of intestinal parasites. We go all the way up to those of you that wanted full protection. Last year, we're getting Revolution, which was the drop that we put on the neck that was transdermally absorbed, and also Simparica, an oral medication once a month to kill fleas and ticks. All the ticks, and I'll tell you, ticks have become a real problem. We'll do a tick talk in a little while, but we're seeing ticks every week on dogs. It's a common problem, and now what we have this year, we can introduce a new product, Simparica Trio, made by the same people that made Revolution and Simparica, but we've combined the effects, so one tablet, chewable, once a month, will kill the heartworm, roundworm, and hookworm, two major intestinal parasites, the most common we see and transmissible to people, and also all the ticks and fleas. And that's kind of it right now. What I need you to do, though, is to write by email or call in. Let us know that you're ready to pick up the medication. And if you have any questions about which you should be on, we want to make sure we have the supplies available for you so we can start the preventatives by June, and we'll get the blood testing done as soon as we can. Thank you. I hope this has been helpful. We look forward to seeing you here soon at the Animal Hospital of River Oaks.